Welcome to the fascinating world of small intestinal bacterial overgrowth, SBBO. In this video, we will explore the causes, diagnosis, and treatment options for SBBO, as well as its connection to other conditions. Get ready to dive deep into this complex topic. Small bowel bacterial overgrowth, SBBO, is a condition characterized by excessive bacteria in the small intestine. Enteric dysmotility, which refers to abnormal gut movement, plays a key role in the development of SBBO. Reduced peristalsis and impaired clearance mechanisms allow bacteria to grow and colonize. This can be caused by neurological diseases, surgery complications, and certain medications. While SBBO is commonly associated with dysmotility, there are rare subtypes that deserve our attention. Autoimmune overgrowth syndrome, also known as post-infectious SIBO, is an intriguing variant of SBBO. It occurs following an autoimmune response triggered by a gastrointestinal infection. The immune dysregulation leads to an abnormal proliferation of commensal bacteria, resulting in symptoms akin to classical SBBO. Understanding this subtype is crucial, as it opens avenues for novel therapeutic approaches targeting the immune dysregulation. In methane-dominant small bowel bacterial overgrowth, SBBO, high levels of methane-producing bacteria in the small intestine can cause constipation and contribute to irritable bowel syndrome, IBS. Diagnosis and treatment require specific approaches due to the unique nature of this subtype. Antibiotic therapy and altering gut bacteria are potential treatment options. Diagnosing SBBO is crucial for proper treatment, but it can be challenging due to the absence of a definitive test. Advancements in diagnostic strategies include non-invasive breath tests and other techniques like small bowel aspirate cultures, serum marker measurements, and imaging. Evaluating clinical symptoms alongside these methods enhances the accuracy of SBBO diagnosis. One contributing factor in the development of SBBO is bile acid malabsorption, BAM. BAM refers to a dysfunction in the enterohepatic circulation of bile acids, leading to their accumulation in the small intestine. This accumulation alters the luminal environment, promoting bacterial overgrowth. Furthermore, BAM can also impair gut motility, further exacerbating the development of SBBO. Recognizing the association between BAM and SBBO is crucial in refining diagnostic and treatment strategies for individuals with both conditions. Antibiotic treatment is essential for managing small bowel bacterial overgrowth, SBBO. However, selecting the right regimen is complex due to different bacteria and resistance patterns. Rifaximin, metronidazole, and neomycin are commonly used. Combination therapy and personalized approaches may be required. It's important to consider antimicrobial stewardship and minimize antibiotic resistance. This video will review the effectiveness, duration, and possible side effects of various antibiotics for SBBO. SBBO is not solely limited to bacterial overgrowth but also encompasses small intestinal mucosal damage. This damage can occur due to various mechanisms, including bacterial toxins, pro-inflammatory cytokines, and disruption of tight junction proteins. The resulting mucosal inflammation and barrier dysfunction contribute to symptomatology and the potential development of systemic complications. Understanding these mechanisms is crucial for developing targeted therapies aimed at mucosal healing and restoration of the intestinal barrier function. Probiotics have gained considerable interest in the management of SBBO. These live microorganisms claim to provide beneficial effects on gut flora composition and immune modulation. However, deciding which probiotic strains to use and in what dosages remains a subject of ongoing research. Furthermore, caution must be exercised in selecting appropriate probiotic formulations, as some strains may exacerbate bacterial overgrowth. We will explore the current evidence regarding probiotic use in SBBO and discuss the potential benefits and limitations. Small bowel diverticulosis, a rare condition, involves multiple diverticula in the small intestine. Recent studies suggest a link between small bowel diverticulosis and SBBO. This association may influence treatment options for patients with both conditions. Gastric acid suppression therapy, commonly achieved through proton pump inhibitors, PPIs, is widely used in the management of acid-related disorders. However, PPI use has been associated with an increased risk of SBBO development. Acid suppression alters the gastrointestinal pH, favoring bacterial colonization and overgrowth. This association necessitates careful consideration of the benefits versus risks when prescribing gastric acid suppression therapy. We will discuss the evidence linking PPI use to SBBO and explore alternative strategies for acid-related disorders. The impact of SBBO extends beyond gastrointestinal symptoms, manifesting as malnutrition and micronutrient deficiencies in some patients. Altered nutrient absorption, impaired gut function, and competition for nutrients by the bacterial overgrowth contribute to these deficiencies. Adequate nutritional assessment and supplementation are vital in managing SBBO patients. We will delve into the mechanisms underlying malnutrition and micronutrient deficiencies in SBBO and discuss strategies to optimize nutritional status. SIBT is the movement of bacteria from the gut into the bloodstream. It might be linked to SBBO. Research indicates that some individuals with SBBO have bacteria in lymph nodes and distant areas. Further study is needed to understand this connection better. Our video will dive into SIBT and its possible role in SBBO. In conclusion, small intestinal bacterial overgrowth, SBBO, is a complex condition with various clinical manifestations. It involves issues with gut movement, immune responses, and bile acid absorption. Advanced diagnostic tools, like breath tests and cultures, aid in identifying SBBO. Treatment approaches include antibiotics, probiotics, and addressing associated conditions. Factors such as small bowel diverticulosis, use of gastric acid suppressants, malnutrition, and bacterial translocation affect the course of SBBO. As healthcare professionals, it is essential to stay updated on SBBO's complexities and utilize evidence-based methods for management. By doing so, we can contribute to better patient outcomes and further advancements in SBBO understanding.